Well, hello everyone, and welcome to COVID Ethics Update. This is a service of the Center for Practical Bioethics and something we've begun offering about 3 or 4 weeks ago as a result of the work that we're doing in trying to respond to the ethical dimensions of the pandemic in today's society. Thank you for joining us. This is a continuing series, and we've been inviting guests from all across the country, and particularly in this region of the world that we serve, in the Kansas and Missouri area, to join us to talk about important issues, especially from the ethical dimensions, that are really important for us to consider as a society and individually in terms of our responsibilities to those who are being impacted by this insidious illness that has kind of really captured the globe and really, I think, revealed to us a lot of things about ourselves and the way that we care for others in very stark terms. My guest today is Mitzi McFatrich. Mitzi and I have known each other for many, many years. She is an incredible advocate for older adults in the state of Kansas and really throughout the region. And she has been at this for a long, long time. I'll let her tell you about the work that she has done. And I am particularly grateful for her time today because I think she has a lot of important considerations for the most vulnerable population that has probably been impacted by this illness. And I think it's really important for us to figure out how it is that we can really integrate some of those obligations and duties into our own lives and our own work within our communities and within those that we provide care to. So Mitzi, thank you very much for joining us today. And since most of our listeners and subscribers probably don't know a lot about you or your organization, would you spend a few minutes just kind of filling us in a little bit about the work that you do and how long you've been doing it and in what parts of the country?
John, it's so good to be with you today, and thank you for the opportunity to be here and talk about these really important issues. Kansas Advocates for Better Care has been around for 45 years. And we were founded by interested citizens who were concerned about long-term care and the quality of the care that older adults were receiving, primarily in nursing facilities in 1975 when we started. The founders of this organization launched the nursing home reform movement in Kansas and were one of a handful of consumer advocacy organizations that launched the national nursing home reform movement and secured the passage of the 1987 landmark Nursing Home Reform Act at the federal level. So we've been doing substantial advocacy to improve long-term care for a few decades now. And while I haven't been here all of that time, my entire career has also been in advocacy, sometimes for domestic violence victims, sometimes for child abuse victims, sometimes in healthcare, and for the last 20 years in the arena of advocacy for older adults. I've been here at Kansas Advocates for Better Care for 13 years. And we advocate with individuals that are looking for good long-term care or having problems with it, whether that's at home or in a care facility. We do training for professionals and family caregivers, for law enforcement and many others. And we also do public policy advocacy with the federal and state governments, both regulatory side and statutory side.
Well, that's quite a handful of work. So I know that you have been at this for a long time, really working very closely with long-term care in the state of Kansas. And that's kind of where I'd like to go with the first question and really kind of get into this. So we know in the Johnson County and Wyandotte County area, which is where we're located, that, and I saw another report early this morning, that almost 3/4 of all the deaths which have occurred as a result of COVID-19 in this part of the state are in long-term care. And so I'd like for you to share a little bit about the concerns that you have about the vulnerability of this particular illness related to that population, and what we can as supporters of older adults do in making sure that we provide, the best support and care that we can to that population, kind of particularly because they are so vulnerable.
So you're absolutely right. The people that we are talking about that live in long-term care facilities are socially vulnerable. and they're oftentimes medically vulnerable and sometimes cognitively vulnerable as well. So there are a lot of layers of risk for people who live in long-term care facilities. And in Kansas, we'd be talking about nursing facilities, assisted living, residential healthcare facilities, home plus, boarding care homes. And while the federal government only regulates nursing homes and the state regulates the rest, the reality is that the state has chosen to follow the federal guidance that has been released about nursing homes in all the other facilities. Okay. So there is some uniformity there. And there are a number of ethical issues that have arisen during this pandemic. And again, they are very layered issues. One of the first things that the government did was to begin to restrict visitors and visitor access in nursing facilities. Why is that of a concern? Because older adults are often isolated, they are often lonely, and they are often bored in long-term care facilities. They rely on friends and family to connect them with the outer world, to bring meaning and purpose into their lives, oftentimes in important ways. So the fact that we don't have visitors going into care facilities right now mean that older adults who are already isolated, lonely, and bored are probably experiencing that at a very high level. It also means that the people who are typically the ones who may report concerns about poor care, about neglect, about abuse, actually are not in the facility right now to see that. So we have a lot of concerns about what that means for the health and the safety of older adults in care facilities right now. The second thing that happened was that group activities were suspended. So now older adults not only don't have access to visitors and the regular communication they have with the outside world through those visitors, they also aren't having group meals. They are primarily being asked to stay in their rooms. So I'm stir crazy after a few weeks of just having to be at home. I can't imagine what it would be like to be confined to essentially my bedroom or half of a room that I shared with one other person. I think that also has been very challenging for older adults in terms of their mental health, as well as their physical health. The exposure that they've had to others from the outside have primarily been from their care workers and any healthcare worker who might be there to see them. So older adults are really struggling right now with that kind of isolation and confinement on a much different level than all of the rest of us are. So that's one area of concern as we think about who gets to make those choices, who implements those choices, who decides when they are imposed or lifted. And all of those things have ethical dimensions in terms of how decisions are made, who makes them, for how long, and for the public good. So that's one set of issues. Another set of issues that we're concerned about is public information about outbreaks and where they occur. Some states have taken what I believe to be the proper approach, which is on a daily or weekly basis to release the information about which care facilities have outbreaks so that older adults in those facilities are aware, their families are aware, and in general, the public is aware, because understanding where there are outbreaks impact decisions that are made at a policy level. It also impacts decisions that are made by families about whether they leave an older adult in a care facility or they remove the older adult from the care facility, which raises a whole nother set of issues of providing safe care at home and workforce issues around that. So public information is really key and critical. There are many older adults being released from hospitals post-surgery who cannot find out if the facility they are considering has had an outbreak. That affects their health and well-being. It also is problematic because until last week, there was no requirement that facilities had to notify residents that there was an outbreak in the facility. And we've seen many instances where residents have been harmed by that, and family members have been harmed by that if a resident was released from rehabilitation, went home, and then infected other people. So
that is a documented case in the Kansas City area. So
yeah, it is.
You're pointing that out. Tell me, it's a balance though between kind of transparency and privacy concerns. I know you're an advocate particularly for that as well. How do you balance the obligations and the public good and individual protections so that we really are providing the best care possible and the best protection for those individuals that might be impacted, both family and residents and the operators of those facilities?
Absolutely. So I think what is protected in the United States is individual healthcare information. We aren't asking for the release of that kind of information. What we're asking for is informed decision making. We're asking for information that would allow people to have the ability to make informed decisions about their long-term care choices. I believe that is a public health concern. And I believe that we aren't meeting that public health concern in the way that we are protecting that information, hiding information, not making that information transparent at this point in time. And the idea that somebody only needs that information at their county level is not really helpful, because having someplace central to go to in a crisis such as this is really important. And we see that with the kind of COVID public health information that's on the KDH&E website, that the federal government CDC website is posting. So we know having a central location to get that information is key and critical. And that's one of the reasons we're asking for transparent information at both the federal and state level about care facilities and where there are COVID outbreaks.
Well, thank you. And this has really helped to kind of get a bigger picture of kind of the considerations that you have from the inside in advocating for those individuals. And this is particularly impacts the center's work too, in terms of it trying to advance the issue of advanced care planning and the importance of having really serious conversations with residents and their agents about particular kinds of treatment that they may or may not want should they actually have an outbreak in the facility or end up in the hospital. So talk to us a little bit about the importance of involving the family in those kind of more intimate discussions around treatment and goals of care when many of them are separated, physically, and you're trying to do this through technology that it doesn't really facilitate intimacy at all. Talk to us a little bit about how can we make that happen and at the same time deal with the challenges of this distancing that's really foisted upon us for the protection of everybody.
John, you've raised an issue about advanced care planning and the need for people to make decisions. And you've also pointed up the difficulty in the implementation of that. There was a time that everybody had a landline, and that included people in nursing facilities. My grandmother lived in a nursing facility. She had a landline. My parents saw her and called her every single day, as did many other people in her family. Right now, one of the things that we're hearing from residents and from families is they may be calling to talk to someone, and there is one central phone at the nurse's station because people aren't having landlines in their room anymore. Many older adults don't have access to tablets or the internet or cell phones. And so when families are calling to talk to a loved one, they might get an answer from the nurse's station, and they may not have anybody able to take the phone down to the resident's room and stay there for the resident to use the phone or help the resident to use the phone. So those kinds of really practical things, not only is there the issue of people may not want to have those conversations, but
they're hard to have, yeah, right.
Yeah, of, is it even possible to have those conversations right now? And so when you raise that issue, one of the things that comes to mind for me is we have an obligation, it seems, to provide people a means to communicate with one another. And there are so many reasons for that. There's the loneliness, the boredom, the isolation that I've already talked about in terms of mental health and well-being. But there's also this issue of, you know, we are in the midst of a pandemic. I've already had those conversations with the people in my life that would be called upon to make those decisions if I couldn't make them for myself. How are we facilitating?
I think that's great.
For the people at highest risk right now? And we're not. And that is a very legitimate concern.
Yeah, and to put a plug in, we are actually doing 2 webinars, one last week and one this week, which will air on Thursday, tomorrow, on the 7th of May, with Dr. Jessica Calendar-Rich, who has work that she does with a number of facilities and is a tremendous physician leader across the state of Kansas and the country in terms of that. So we'll be, you put in a nice plug for us for the webinar that we'll be hosting tomorrow. So we need to wrap this up. I really want to express my deep appreciation to you for joining today. Tell us, give us one nugget, if you could leave us with one thought about what you consider, those of us that, all my in-laws' parents are gone. They all had long-term care provided to them prior to their passing. And they had, for the most part, really pretty beautiful deaths. And in many cases now, as we see this tremendous number of deaths in long-term care facilities across the country, what kind of advice would you give us all as a collective citizenry that wants to be in solidarity with this people? What bit of advice, what bit of counsel do you have for us?
I think I always come at things from an advocacy perspective, whether that's on behalf of a single person or whether that's for everyone that is affected by this. And so really there are 2 things I'd have to say. From the big picture perspective, we must speak out for the public policies that will address the risk of this pandemic in nursing facilities and other adult care homes. We have to call for adequate personal protective equipment. We have to call for adequate testing available in facilities. We have to call for public information. And at the individual level, don't be afraid to ask for what you need if you're a person in a long-term care facility or if you care for someone in a long-term care facility. Don't be bashful. Ask for what you need. Ask others to share resources that you may need if you don't have them. Make sure that, to the best of your ability, there is a means for people to communicate and stay connected. That's vitally important for for people to be able to thrive, not just survive.
Well, thank you. Good advice and sound counsel, as always. Thank you very much, Mitzi, for joining us today. And thank you all for being with us for COVID Ethics Update. I would like to ask all of you to make sure that you subscribe to our service. You can also subscribe to follow us on Facebook and on our YouTube channel. You can do that by going to the center's website and subscribing to this COVID Ethics Update, and also by going to YouTube and typing in Practical Bioethics. And this particular session will be archived there and also promoted to all those who subscribe. So again, thank you very much. So it's COVID Ethics Update. If you'd like to subscribe, please do so. Mitzi, this has been tremendous for me to know that somebody that has worked in this field for a long time is still finding the energy and the passion and the compassion to be able to advocate for those who are truly probably the most vulnerable population related to this pandemic outbreak. So again, my thanks to you personally and professionally for all that you do, and thank you for joining us today.
It was a pleasure, John. Thank you.